That's what a diagnostic test does. It gets you on the right path early. Many patients with asthma and other respiratory diseases, they're not diagnosed right away. The length of time from their initial presentation to diagnosis can be quite long. And during that time, they're suffering. So I think it gets you on the path correctly as early as possible. You have a diagnostic measure once you're diagnosed to monitor your treatment in response to treatment, whether that's medication, whether that's exercise, pulmonary rehabilitation, so on and so forth. And so it's a real yardstick that I think is just vital in disease management.
Welcome to Beyond the Wheeze, the podcast where perseverance meets potential. I'm Josh Realm, public speaker, marathon runner, asthma advocate, and your host as we explore the intersection of health, fitness, and resilience. Whether you're managing asthma, chasing a new personal best, or simply looking for inspiration, Beyond the Wheeze is here to show you that no challenge is too great to overcome. Together, we'll uncover stories, insights, and strategies to help you push beyond your limits. It's time to breathe deeply, move forward, and unlock your true potential, one step at a time.
Today, I have the distinct privilege of welcoming Dr. Neil Maharaj to Beyond the Wheeze. Dr. Maharaj is a respirologist based in Niagara Falls, Ontario, Canada, with over 20 years of clinical experience in respiratory medicine. He is the medical director of Niagara Pulmonary Medicine and Diagnostics, a comprehensive community-based pulmonary specialty clinic serving the Niagara Peninsula. Dr. Maharaj oversees all clinical activities and manages an on-site pulmonary function testing lab that helps optimize patient care. Alongside his clinical work, Dr. Maharaj is a respected medical leader. He has served as chair of the Medical Network and chair of the section of respiratory disease at the Ontario Medical Association, representing and advocating for hundreds of specialists across the province. Today, we'll explore the current landscape of asthma care in Ontario, the crucial role of pulmonary function testing, how technology is shaping the future of respiratory medicine, and practical advice for both clinicians and patients navigating asthma care today. With all that being said, Dr. Neil Maharaj, welcome to Beyond the Wheeze. It's an absolute pleasure to have you here.
Thanks, Josh. Thanks for having me here. I've been a fan of your podcast. I've heard a couple of your episodes. You've had some wonderful guests, and hope I can live up to that.
Thank you for coming on. I appreciate your attendance. And one of those guests might be Sahil, which of course is the founder of DIA Labs Canada, which is the reason I was able to get connected to you. So you mentioned you and the work that you did, and I figured you'd be an amazing addition to the podcast. And I think your insights can only be incredibly valuable. So thank you again for joining us today.
No, my pleasure. My pleasure.
So we'll jump right into it. I know you're a busy guy. We'll start with reflecting on a career in pulmonary medicine. I think it's important for people to know who we're talking to. Dr. Maharaj, you've built your career in both clinical practice and leadership over the past 2 decades. Looking back, what moments or experiences stand out as especially meaningful or impactful in your journey as a respirologist?
Oh, that's a great question. I mean, for me personally, it's really about the story, and the stories are made up of people. It really does come back to the incredible people I've had a privilege to either care for as patients, work alongside with as physician, and that includes mentors, that includes their staff, nursing staff, as respiratory therapists that I get very, very lucky to have learned from and also participate in care. So, my journey started many, many years ago. The son of immigrant parents, they were emigrated from the Caribbean, and so that work ethic was kind of instilled in me at a young age. And as a child, I had asthma. So it's interesting that I, like yourself, have kind of come full circle back into the asthma foray. So, in medical training, I've had amazing mentors, both in Ottawa, where I trained, and also Saskatchewan, where I also trained. But a lot of those experiences stem from patients. It's a real privilege for patients to really open up some of the most private aspects of their lives to me and try to help them. And so doing, I've been fortunate many times to be able to participate in that and that assist to them. But it's a very symbiotic relationship. Not only do I help them, they help me. I learn from them. And while admittedly I have lots of great stories, unfortunately sometimes bad outcomes do happen. And while that's incredibly unfortunate, it's been very instructive for me to try and correct or address those issues if there are educational issues that are around those outcomes, so the next person doesn't have to suffer from that. So I could spend a whole entire podcast just talking about these moments, but there's been so many that I think kind of tethered together to kind of shape me into the respirologist and person that I am. So I've been very fortunate that.
You lead Niagara Pulmonary Medicine and Diagnostics, the only community-based pulmonary clinic of its kind in the Niagara Peninsula. How did this clinic come to be, and what gap does it fill for patients and the broader health system?
Yeah, I've been in Niagara. It's a good question. I've been in Niagara for about going on 13 years now. And, I had a vision, and I learned that when I was a young trainee. I was exposed to different clinics in different subspecialty areas, and I was fortunate enough to work with a couple of cardiologists in the Ottawa area who were very, very forward-thinking, and they created a cardiac center that was just dedicated to cardiac disease. And at the time, it wasn't as common as it is today in various communities, but I really learned a lot from that experience, and I thought, this would be something that I see this value of that for patients. I see the value of that for the community, and I would like to do that. And I wasn't going to be a cardiologist. I'm a respirologist. I thought maybe cutting that experience for respiratory patients would be benefit wherever I end up kind of hanging a shingle. And so that vision has stuck with me, since my early 20s, and I'm 50 now. So that it was really, really impactful for me. And so I tried to create that in Niagara, and I was fortunate to take over a pulmonary function lab that was here as part of that vision. And so we built a great team. I'm really lucky to be working with the people that I do work with on our team. And we all really adhere and believe in that vision and really creating a community-based specialty clinic for respiratory disease. This is all we do. And we do it again, over and over again. So we see this whole gamut of respiratory disease, and we're very passionate about doing that and being accessible as possible for patients.
With your leadership roles at the Ontario Medical Association, how do you see the evolving needs of respiratory specialists and their patients across Ontario?
I mean, obviously I'm biased, but I say respiratory specialists are needed now more than ever. As alluded to in the last question, the changing climate is just one reason as to why that is. But last year, the World Health Organization, they listed their top 10 diseases of mortality globally in the world. And 5 of those top 10 were diseases of the respiratory system. So the burden is immense. COPD, for example, is the 3rd global leading cause of death. It's on the rise, actually. If you look at the top leading cause of death, COPD is one of the few that are on the rise, actually. Most are declining, but not COPD. 50% of patients with severe asthma globally live with poor control. So over half of them are not controlled, though they think they are controlled, but they're showing up in emergency rooms. They're having absences from work and school because of their asthma. And that's over half of the asthma population worldwide. In Ontario, asthma is the #1 chronic disease of children, that statistic really shocks me as an adult respirologist, because we don't often think of chronic diseases in children, and yet asthma is the #1. You've lived with that. I've had experience with myself personally too. And so that's an alarming statistic. So I think respiratory specialists are needed now more than ever, and they're going to be needed more in the future. And so I really do advocate for that at the OMA on the respirologist side, but I also recognize and value my team members. You've had incredible respiratory therapists. I'm very privileged to work with a couple of respiratory therapists, both in my clinic. And without them, we cannot do the job that we need. The other important team member are patient families. They're the ones helping their loved ones. And they have a wealth of knowledge that sometimes we as respirologists or care providers don't appreciate fully. So it's a real team aspect.
So let's move on now to the role of pulmonary function testing in asthma care. Pulmonary function testing is often called the cornerstone of respiratory diagnostics. Can you explain why access to timely and comprehensive testing is so critical for people with asthma?
Absolutely. I think, I'll illustrate this with an analogy. Just imagine yourselves 25 years ago, you're going to meet some friends at a restaurant and you've got a reservation in 30 minutes and you're going to walk to that restaurant to meet them and you want to catch up with them. You haven't seen these friends all. So you're walking and you get lost along the way and you end up being about half an hour late. So they've already started the dinner. You join them. You're a bit frazzled and stressed. You complete the evening, but it wasn't what you thought it was going to be. Fast forward to today, that wouldn't happen. And that wouldn't happen necessarily because you've got Google Maps on your phone, right? You're just going to punch it in and go. You've got a diagnostic tool here to get you on the right path. And so you get there on time now. Actually, you might get there early. You're not stressed. You have a really enjoyable evening. You catch up, and it's a much better experience. That's what a diagnostic test does. It gets you on the right path early. That's how I view it. Many patients with asthma and other respiratory diseases, they're not diagnosed right away. The length of time from their initial presentation to diagnosis can be quite long. And during that time, they're suffering. So I think it gets you on the path correctly as early as possible. And now you have a diagnostic measure once you're diagnosed to monitor your treatment in response to treatment, whether that's medication, whether that's exercise, pulmonary rehabilitation, so on and so forth. And so it's a real yardstick that I think is just vital in the disease management.
And what are some of the barriers that patients face in getting pulmonary function tests done properly? And how does having an on-site pulmonary function lab at Niagara Pulmonary Medicine and Diagnostics change the patient experience?
Yeah, I think there's a lot of barriers in place, especially in Ontario. If you think about the diagnosis of diabetes, for example, it's a fasting blood glucose. That's a very accessible test. Measuring lung function actually is not all that complex, but it is complicated in the sense that you need a trained technician to perform the test. You need to feel comfortable in test interpretation. You need to have a control system in place to make sure that you're measuring things correctly. And so these factors are actually barriers because people, for example, many primary care offices feel intimidated by that because they don't have those expertise. We have it in Niagara Pulmonary Medicine. We're one clinic in a very small group in the province of Ontario. So I think that the complicating factors are barriers. Funding is one small aspect of it, but it is an aspect of it that I think does merit attention. Pulmonary function diagnostics and the funding for that has been really restricted. And that affects the availability of that. Many hospitals are performing those tests and getting into hospital is not easy. You've got to pay for parking. You've got to find it. Hospitals aren't very intuitive depending on the hospital that you're in terms of finding the patient. So there's a lot of barriers there. And so having it on site, just practically speaking, we are a ground floor clinic. We are fully wheelchair accessible. There's free parking. And we are regularly engaging in our community, having a presence so the community knows where we are. So in order for us to be found, they need to know that we're here. And so we make sure that we're present and we have a presence in the community. It doesn't remove every barrier by all means, but it certainly does break down a lot.
From your clinical perspective, how does the availability or delay of these tests impact asthma outcomes and management strategies?
Yeah, if you have a delay in diagnosis, you're already way behind the eight ball. And so many times we're seeing patients that have been sent to me from the emergency room. They've shown up in the emergency, or they've gone to the emergency room 5 times in the last 6 months. And they're only on, for example, their salbutamol inhaler, not recognizing that, well, hey, there are other potential options that we can administer to get you much better control so you can have some normalcy to your life. And so the delay in the diagnosis delays their care, it prolongs their morbidity, and it's just a cascade effect. So having the diagnosis done earlier with the appropriate testing really puts them in the driver's seat much earlier in the course of their disease.
So now I'd like to move on to technology, AI, and the future of pulmonary medicine. You recently shared your experience observing Node AI's AI-enhanced endobronchial ultrasound technology, which aims to improve lung cancer diagnostics. How exciting is it to see these advances in real-time clinical settings?
Yeah, Node AI was special. I won't speak on behalf of the company, but that was a very special experience. A really well-respected colleague and friend who has been working on this development, I guess, over the last, I want to say 10 years, or possibly even longer. And having this come to be realized is exciting. For that technology, for example, to really move the needle on lung cancer diagnostics, shorten wait times is phenomenal. I say AI is everywhere, and the potential for AI to ease burdens, to shorten wait times, to improve diagnostics, to support care providers and clinicians, it's huge. A lot of what we're seeing currently, because we're in its infancy, is reducing administrative burdens and improving that, and that's been significant. What I haven't talked about as much as some of those administrative burdens humans have put in place already. So now we're using a machine to remove the burdens that we put in place, and so we can really capitalize on that by downgrading some of those administrative burdens to see, do we really need this stuff currently to practice various specialties? But using AI to kind of sift through that and to help us with really complex analysis, support that would be, it's huge. It's really, really a game changer.
Beyond diagnostics, how do you envision artificial intelligence and digital health tools influencing asthma care and respiratory medicine in the next 5 to 10 years?
I think doctors will, at least for the foreseeable future, it's important to have a human, and especially as we're learning and developing safeguards around this technology. But there's been a lot of interesting work done on AI automation, which you've kind of touched on the last question. Imaging analysis has become a really hotbed of research, and that includes early detection of lung cancer. That includes earlier detection of findings consistent with COPD or asthma. So, for example, it allows pulmonary function to not necessarily be done in the clinic, but potentially be done in the hands of the patient. If you could imagine if you had a smartphone with an AI attached algorithm and a way to measure that airflow, that could be done in the hand of your smartphone. So it really put the power back into patients. Personalized medicine has been a buzzword for a long time. And so AI analysis of biomarkers in asthma, for example, which, it is a really, really important avenue for asthma treatment, but using AI to discover new biomarkers, to discover new therapeutics. There's virtual care models, physician access and healthcare access is an issue, but maybe a hybrid model where there may be some decanting through AI proven and validated chatbots, for example, can help offset some of that burden. There's lots there. AI integrated smart housing, smart facility, where you can have AI integration that is aligned with privacy measures, but that can detect aspects of disease that humans hadn't responded to. The potential is huge.
I've had this conversation with someone recently. I believe it was Dr. Maharaj Khan.
Oh, yes.
And we discussed, ethics behind AI and how to use it safely. But we also discussed, as you kind of mentioned and noted in that previous answer, the importance of having a doctor's feedback, the importance of having that human factor as well, not just to let AI kind of take control of it. We're allowing doctors, patients, really everybody across the board to be part of that. Nobody really trusts AI until they do. Unfortunately, I think we're at a day and age right now where we're at that weird kind of boundary between, AI is coming in, whether we like it or not. Khan said as well in that podcast, AI is not here to take over our jobs. When we had farmers that were out doing this and that and do this and that, they're super busy. Well, then they got tractors, and those tractors allowed them to get the job done faster so they can then focus on something else. AI is not going to be the final technology. We're going to have something after that and after that. And I think it's important to know.
Yeah, I think that's well said. I did listen to that podcast. I do remember that tractor analogy. And, at the end of the day, you want a human, I would think, helping you with your asthma. They may be supported by AI, which makes that human individual or team better at caring for you. But you want it through the filter of a human being. Yeah. I think that's it's important to be human in this line of work. So I can't see AI replicating that very easily.
What are some practical challenges clinicians face in adopting new technologies, and how can the healthcare system better support integration of improved patient care?
Yeah, the development of some of these technologies, particularly AI, is based on training data and training data that we have already collated and derived. And so there's a tremendous amount of bias. And so bias in AI has really been an issue very clearly identified. And so we really need to be aware of that and make sure that we are mitigating that. We don't want our biases, our human biases, amplified in AI by a faulty algorithm. And so that trust, building that trust baked into that is recognizing that bias and having safeguards in place to address that. And so any AI algorithm should be validated and obviously tested. That goes without saying. It sounds obvious, but you want to make sure that there's an important outcome that's being improved upon with this algorithm. So that needs to be studied. I mean, a lot of these AI-derived tools are very slick, but the validation piece, which is very, very time-consuming, is a critical step. And privacy is a big issue, which again, some of your guests have already talked about, and we're still navigating that, particularly on the physician side of things, and making sure that aspects around PHI, personal health information, it is appropriately addressed. The legal framework with which AI operates under is quickly evolving. If heaven forbid something goes wrong in healthcare, unfortunately that trends have happened more often than we would like, where does the fault lie? And so, navigating that, because that's a real challenge and it's not going away anytime soon. And that's going to evolve too. And so we really need transparent and robust policy to outline and frameworks for dealing with that. And integration, interoperability has been a real nightmare in healthcare management. If you look at clinics and hospitals with different EMRs that don't talk to each other, and now you're throwing in AI and other health tech, how are we going to integrate that? Is there appropriate interoperability to really kind of reap the benefits of that? So there's a lot of challenges there.
So let's focus in a little bit more on Niagara Pulmonary Medicine and Diagnostics, your clinic. So meeting local respiratory needs in Niagara, essentially. Can you describe what makes Niagara Pulmonary Medicine Diagnostics unique in terms of the care that you provide and the local respiratory needs that you meet?
I think, again, I'm going to show my bias, but I think we have a strong track record. We've been in the community for about 12 years now. And we have a firm stake in the ground. We are here for the community. We've got a great team. I'm really blessed to have incredible respiratory therapist and great administrative staff. I have a great family behind me supporting all of us. And so I think the people that work in the clinic really care. They've been with us for a long time. And we really make ourselves available for our community. We are a full-service respiratory clinic and pulmonary function lab. We cover the gamut of respiratory disease, and we don't turn patients away. And we're also venturing into new forays too. We are expanding our diagnostic services. We hope to have some news on that in the next 6 months or so. And we also, with my work with the OMA on the political side, I have that line of sight as well, where the advocacy work that we do on the political side helps inform our decisions locally as well. So, we really try to integrate all of our expertise in our healthcare system with a local flavor to it, and I think patients are best served, and I think it's really fostered really nice environments.
Do asthma patients in smaller or mid-sized communities like Niagara face different challenges compared to those in larger urban centers? And how do you tailor that approach to address these?
There's challenges in respiratory medicine, I think, faced in all size centers, urban, mid-size, rural, small-sized community. We are a smaller-sized community, just like you are in Sudbury. And so we do have additional challenges, I think, or different challenges, maybe I'll say that. Some of that can be bridged with technology. Now, there are virtual means of consulting specialists. While maybe not as ideal as an in-person assessment, at least there's a bridge to that wasn't available, let's say 10 years ago. And I'm sure we've seen that evolve and used more frequently. In our local community, the specialist complement to support our primary care colleagues had really been small. Well, that's grown. Again, we're outstripped by the growing population. They're growing much faster than we can grow. But there has been some gains made there. So I do see that being an important development. I worked alongside other specialists to help with very complex respiratory disease. And so the complement has really grown over the last couple of years. We have unique challenges to Niagara. We're primarily a tourist-based economy here. So there's a lot of seasonal work. That affects the economics of patients. For example, this at certain times of the year, they may have the financial means to purchase their medication, and others they don't. If they don't have drug coverage, they don't have third-party coverage, and that's very common in Niagara because of the tourist-based economy. We've got a lot of transient workers here, so there's a lot of seasonal workers here. There's a lot of fruit farms and vineyards, and so we see a lot of international workers that are here just for the harvesting season. And so that brings unique challenges that I don't think they're seen in a lot of other areas in the province. And, there's a lot of retirees that have moved to Niagara. The cost of living has been a bit more favorable compared to Toronto, although that has risen here as well. So that age demographic also impacts the complexity of care that we see here. So there's a lot of challenges. And then, of course, we're close to the border. So we see a lot of dual citizens. And so we're trying to access healthcare in the United States, for example, and vice versa, is always a challenge.
I could see that being a challenge. You're essentially, either you or them, are jumping through hoops.
Both. Yeah, both.
So I'd like to talk now, really to get some advice for clinicians and patients navigating asthma care. For clinicians working in smaller or under-resourced communities, what practical advice would you offer to improve asthma diagnosis and management?
There's some, I mentioned before, now there are services where you're a healthcare provider, physician or nurse practitioner, for example, you can access asynchronous consultation. So there's an e-consult service that's provincially available. That wasn't available, let's say, 5 to 7 years ago. So there's a bridge there. Virtual hallways, another similar platform-based, web-based service where you can access specialists to have a one-on-one discussion. Hey, I have a patient who is having this, whatever it may be. And that's a really important bridge that I participate in both of those. Phoning a friend, whether that's independent of these services, that goes a long way. I think some of the best care that we can provide is just having a direct conversation, as opposed to sending something through a snacks. Mm-hmm. So, these are simple ways to work around that, but they do go a long way. I also think while it's daunting to think about conducting spirometry in your clinic, for those that have less experience, I think that's a really solid investment to learn spirometry. There are courses where you can do that. ResTrek is a course that's available here in Canada. And it's the kind of thing that if you are able to implement that, there's an upfront investment of time. But once you start doing it over and over again, you get good at it. And then you create that expertise, and you can grow that expertise in your local community, wherever that is. And I think the more you do, the more you're comfortable with it. There's lots of CME that's available virtually now as well. Again, that's been exploding over the last several years. I do a lot of that. There's many other amazing specialists and experts across the province you've had on your show that do a lot of that. You learn from them. I learn from them all the time. And there's a lot of symposiums to help kind of bring yourself up to speed. We all do that. I do that. And so I think there are activities where you can do that to try and, filling those gaps that you perceive in your own local community.
Now, for patients and caregivers listening today, what should they know about advocating for their care? Are there signs or steps that should prompt them to seek further evaluation or specialist care?
Yeah, Josh. I think it's critical for patients to be your own advocate. I'm sure you've heard this before. Again, you may have heard this in your own lives, that you really need to be your own advocate. And even if asking the simple question to your doctor, could this be asthma? Asking that question opens up the door, because then that individual has to address that question, and she or he may address it by saying, yes, it is, and no, it isn't, explaining why. But asking, could this be asthma? Mm-hmm. can you check that? Is there a breathing test that I could study to do to help with my cough? Is that necessary? Asking those questions, when a patient's asking that, it shows that they're engaged, and it actually makes me kind of reflect, what is it about their symptom that I'm maybe not be seeing? So asking those questions, should I have a lung function test? That really helps. It goes a long way. Patient portals are becoming more common too, right? So patients could have access to their imaging reports and their blood work, and that allows them to inform themselves and to give them an opportunity to educate themselves. And I think that's a huge benefit. It raises the bar for patients being their own advocate. And so a lot of those aspects, I think, are really, really important. Asking questions. Don't be afraid to ask. Your doctor is there to listen, and it helps kind of address those questions. If you ask them and they elicit it, that'll go a long way for your care.
Great answer, Dr. Maharaj. And I had recently on, I believe it was 2 episodes ago, we'll say 3 episodes ago, we'll say episode 18 of Beyond the Wheeze. I had Fareen Wali Muhammad, which works in health informatics. And she as well, as you mentioned, patient portals, she outlines an insane amount of information. So if you're a patient or a caregiver listening to this podcast, and that is something you want to learn a little bit more about, I welcome you to check out that episode again. That is with Fareen Wali Muhammad. I believe it's episode 18. Check that out if you really want to dive into health informatics, know what your information is doing, where it's going, who has access to it, and really how to make sure you have access to your own medication. I think that's incredibly important.
Oh, yeah, 100%.
So let's dive in now to personal reflections and leadership. You've spoken about the importance of integrity, collaboration, and open communication in medicine. How do those values shape your leadership style and your clinical practice?
I think communication is everything, and it's not just verbal.
Right.
I think 10%. What is it? They say 10% of what we communicate is actually the words. The other 90% is all nonverbal, and so your communication, it communicates everything. But more importantly, your actions will. So, again, coming back to our clinic, I think our actions, our investment in our clinic and our community, helps us communicate our authenticity. And I think that's a really, really important aspect in leadership. It's important if you don't know something, not to fake it, but to say, what, I don't know, but I know where I can get help to know. And so it comes back to being open and communicative, but also being honest and being vulnerable. I think if you're vulnerable to accepting other perspectives, you collectively as a group will be better in that. And so as a leader, I don't think you're not supposed to know all the answers, but I think the goal of a good leader is to be in service to others, to work towards a common goal. And I think the key word there is service to others. As a leader, I'm in service to others. I'm not here to say I'm the boss, but to me, I'm here to help you, to help others achieve what goal we're trying to collectively achieve. And I think that's a really important aspect of leadership that I think is real.
In regards to your leadership role at the Ontario Medical Association, what reflections can you share about your experience there? And how has it influenced your perspective on respiratory care and advocacy?
Through work with the OMA and where other hats too, but in these various roles, healthcare is a very complex machine. There's so many different moving parts to it. We all have different priorities and different positions, but I think it's important to find common ground. You're not going to agree on everything, but there are probably some things that you do agree on. And I think when you're able to find common ground, if you can start from there and build up, that's a really good starting point, because I think that promotes a collaborative effort. Many times competing priorities can lead us down this fight. This is more important, this is more important, but really these are probably symptoms of a much bigger issue, and that much bigger issue is probably where we may feel similarly on. And so I think finding that common element, those areas of common ground, are really, really, really important. We need a lot of evidence to support our rationale and our priority. What does the evidence say on this? What does the evidence say on that? And that's really important. But at the end of the day, that evidence is in place because there are humans affected by these things, and there are stories around them. And so that those human stories drive everything. And so evidence is really important. Like that evidence is derived from healing. People are suffering from disease. And so keeping the human in the loop, I like that expression, to drive what we do is critical. And sometimes we can lose sight of that. It's important to kind of stop and pause and reflect, saying, why are we doing it? Oh, that's right. We're doing service for these reasons, for these people that are suffering. And so a lot of those aspects when it comes to leadership are critical in helping you work towards problems and develop solutions.
What motivates you most to continue innovating and advocating for respiratory health?
I have no shame in saying I'm a nerd. I love learning. I love it, and I think that's a big part of it. It really does energize me, and I love people. I have a great team at work. I'm blessed to have a great supportive family, my wife and my son, and they motivate. They inspire me too. And my patients. I have patients that get better. I have patients that don't. They get worse, and I'm struggling. I'm wondering why. And so that I'm incentivized that. So there's lots of inputs into the system that keep me going. And at the end of the day, I really do, like many of us, want to make the place better, more so than how we found it. And so, using my skills and the skills of others on our team to collectively do that is a real incentive.
So I'd like to move on now, Dr. Maharaj, to guest final thoughts. And before we wrap up, is there anything else you'd like to share with our listeners? Maybe upcoming projects, resources, or possibly a final message? I just want to thank you, Josh, and your listeners for taking the time to listen to this podcast. First of all, I think, we have a lot of interest here in Niagara Pulmonary Medicine. Health tech is something that we're exploring assertively now. So we've been working with a couple of small little projects on that front. I'll have more to say on that in the upcoming months, but that's something that we've already started to integrate into our own office, and we're excited about that. I also have interest in where my fields and the legal framework interests. I find that fascinating. And so, understanding the law and policy has made me a better doctor. And so I enjoy writing about that and engaging with others on topics wherever law and medicine intersect, because I think that's a real intersection that most people don't appreciate how complex it is and how impactful it is on the lives of people. And so I'm always willing to engage with people on matters related to respiratory medicine, health tech, or policy, because I find as I get more mature, more experienced, older, whatever you want to say it, these aspects are becoming more top of mind for me, because there's a much bigger picture that I think we can tackle as we're able to kind of understand these better. That's terrific. Thank you so much for that. And I will ensure as well to put any details, any resources, anything like that I can find in the show notes for our listeners as well.
Sure, that'd be great.
So I'd like to move on now to the final question, which is a bit of a philosophical question. I ask every guest on this podcast, so we'll jump right into that. Whether you have asthma or not, every breath we take is a gift, a reminder of our resilience, our drive to keep going, and our power to define our own limits. With a single breath, you have the potential to move mountains and change the world. With that in mind, Dr. Maharaj, if you had only one last breath, but with it the power to influence the world, what would your message be?
Oh man, that is not an easy question, Josh, but if you have to choose between being right and being kind, I think you're always going to win by being kind. Kindness and being wrong goes much further than ever being right and being potentially hurtful. So, and that sounds very simple, but that's come up many times in my life, and I found I've sometimes learned a lesson the hard way, and I haven't chosen correctly, but what I have in being kind, it's always come up better. The other aspect I think is really important is, I think we all have a superpower, and that's consistency. I think, if you consistently do something over and over again, over time, that consistent effort compounds over time, and you can achieve great things by doing having consistent efforts over time. And, you know, something boring but done over time becomes something great at the end. And so I've lived that, and I continue to live that. And I've seen really good things happen when you consistently apply something over time. So I guess that was some of the things that I would say, I haven't let this breath, that could be a really long breath.
Dr. Maharaj, thank you so much for sharing your invaluable insights today. Your work as a clinician, leader, and innovator in respiratory medicine makes a real difference for patients like myself and professionals alike. To our listeners, if you found the episode helpful, please subscribe, share it with those who might benefit, and leave a review. For more information on Dr. Maharaj's clinic, emerging technologies in pulmonary care, and resources for asthma management, please check the show notes. Until next time, keep pushing forward, keep breathing deep, and never let anything hold you back.
Thank you for listening to Beyond the Wheeze. If you enjoyed this episode, don't forget to subscribe and share. Follow us on Instagram at Beyond the Wheeze, or follow me at the Asthma Runner for more updates. Keep breathing strong, and remember, your potential has no limits. Until next time.